Good morning. Welcome to the Swetland Seminar Series. We're glad you could join us today. We're excited for this panel. My name is Linnea Webb. I'm a project manager here at the Swetland Center at Case Western Reserve University. If this is your first time joining a Swetland seminar, if you're not familiar with us, in the late 1950s, David W. Swetland and Mary Ann Swetland felt that not enough was understood about unintended health consequences of chemical, agricultural, and industrial products in our environment. So they focused the Mary Ann Swetland Professorship of Environmental Health Sciences on preventative medicine and the threats of man-made environmental hazards, so that all graduating doctors would have an interest in and understanding of the impact of the environment on human health. So for over 30 years, the Mary Ann Swetland Center for Environmental Health has cultivated partnerships to develop and expand solutions that enhance environmental health for everyone. And our work encompasses various exposures influencing health outcomes throughout life, such as asthma, chronic diseases, mental health, and infant vitality. We're recognized for our collaborative and adaptive approach that transcends boundaries to foster healthy environments where people thrive. And our mission is to accelerate pathways to vibrant and healthy environments through collaborative research, immersive training, and authentic community engagement. And we can go to the next slide. And if you haven't already, feel free to add your name and organization to the chat box. Okay. So yeah, as I mentioned, our mission, and then we have a three-pronged approach focused on research, training and education, and community engagement. And our goal is to build capacity for the next generation of scientists to work alongside community partners to promote healthy environments for people to thrive. If you're interested in learning more about the Swetland Center, I will put these links in the chat for our website, case.edu/Swetland, and our email as well. We can go to the next slide. So we do have some exciting announcements. First, we have an article in Signal Cleveland that was just released this week, I believe. And we'll put the link to that in the chat as well. And the title is "A Program Gave Medicaid and Medicare Patients Free Fruits and Vegetables. The Challenge, How to Keep It Going." So it's highlighting this produce path coupon program, which the panelists will be talking about today. So make sure to get that link in the chat for you. Another big announcement that we're really excited about is we have an RFA that we just released last week, small scale incubation funds to identify best practices for locally rooted produce prescription models. So this RFA is part of the fruit and vegetable strategy of the CDC-funded Cuyahoga County REACH grant, which is managed by our team at the Swetland Center in partnership with the Cuyahoga County Board of Health here in Cleveland. In this RFA, we will select up to 2 partnerships to support implementation and evaluation of produce prescription or PRX programs in Cuyahoga County that are locally rooted. The goal of these small-scale incubation awards is to learn about the needs and opportunities of different produce prescription programs to guide expansion within Cuyahoga County over the next 2 years. The application's open now, and they're due February 15th. And then we will interview selected candidates February 25th through 27th. And then our final decision will be made by March 5th. So we'll notify all the candidates by then. And the program would run from March 11th through July 31st. So it's kind of a short term, but it's really meant to be sort of a pilot to test out these ideas. So we are actually having an information session today at 3 p.m. on Zoom. We will add the registration link plus the links to the RFA and application to the chat. So hopefully you can join us today at 3. If not, we will record it and put it on our YouTube channel. Okay, go to the next slide. And our next seminar next month, Housing and Infant Health Targeted Investment and Meaningful Engagement, or the TIME study. It's on Tuesday, February 17th from 9 to 10 on Zoom. And our speakers will be Dr. Dina J. Chisholm and Dr. Kira S. Barnett. They're from the Center for Child Health Equity and Outcomes Research at the Abigail Wexman Research Institute at Nationwide Children's Hospital. And we'll make sure to add the link to register for that in the chat, so you can join us for that. And on the next slide, we have an announcement about our March Swetland Seminar, which will be on a different date and time for next month. So it'll be Wednesday, March 18th from 12 to 1 on Zoom. And that one is gaining consensus on metrics of nutrition equity for urban food systems. And Dr. Darcy Freedman, Dr. Owusua Yamoah from the Swetland Center will be presenting. So we'll make sure to add all these links into the chat, and you can always check our website for updates on the rest of the 2026 Swetland Seminar Series. And then you can also subscribe to our newsletter, the Swetland Scoop, for more updates on what we're doing. So I'm going to turn it over to our director, Dr. Darcy Freedman, to introduce today's panelists.
Good morning, everybody, and we're excited to be here today with 4 amazing panelists who will be able to share their first-hand insights from different perspectives related to the Produce Path coupon program, a produce prescription program that was tested out last summer in 3 counties in Ohio. So I'm going to start off by introducing our panelists. Miss Mamie Priestly is a patient who participated in the Produce Path coupon program. Mamie is 64 years young. She lives alone and is happily retired due to her disability. She gets all of her medical care at Metro Health Broadway. That is where she noticed the staff offering vouchers to purchase fruits and vegetables. She immediately signed up to participate in the program, and she was able to purchase free fruits and vegetables, which she really needed. Miss Traci Singree is passionate about all things local and loves connecting farmers with their community. As the executive director of the Cuyahoga Valley Farmers Market, she keeps things running smoothly and makes sure everyone has a great market experience. She's a big supporter of sustainable agriculture and believes in the power of local foods. Traci's friendly and approachable, and she's always happy to chat with vendors, volunteers, and market goers. Dr. Owusua Yamoah is a research scientist and the community engaged research lead at the Marianne Swetland Center for Environmental Health at Case Western Reserve University. She received a PhD in spatially integrated social sciences from the University of Toledo, an MA in urban studies from Minnesota State University, and a Bachelor in Science in Development Planning from the University of Science and Technology in Ghana. Dr. Yamoah's work is primarily focused on using community-engaged approaches to leverage the lived experiences of low-resource communities to inform policy, systems, and environmental changes necessary for reducing health disparities. Dr. Yamoah was a project lead for the Produce Path coupon program. And Dr. Shari Bolen is the Alfred F. Connor Senior Health Services and Population Health Research Professor, Professor of Medicine, and Executive Director of the Population Health Research Institute at Metro Health. Dr. Bolen is also the Director of the Center for Healthcare Research and Policy at Metro Health and Case Western Reserve University. And she's the co-principal investigator for the Northeast Ohio Quality Improvement Hub. So I'm going to turn down our slides now, and we are going to begin our presentation by kicking off with Dr. Bolen.
Morning, everyone. Delighted to be here with all of you this morning after this long weekend and very chilly weather that we're having. Some of you may even have kids at home if your kids are off school. So yeah, delighted to talk a little bit with you about our Northeast Ohio Quality Improvement Hub and set the stage for their group to talk more about the Produce Path program. Next slide. I just want to acknowledge the participating primary care practices, farmers markets, and project team staff that really helped make this program a success. Couldn't have done it without them. I also really wanted to recognize the prior work that informed this project and continued work in produce prescription that has been funded by the Centers for Disease Control and Prevention, their REACH grant, and the Cuyahoga County Board of Health in collaboration with the Case Western Reserve University Swetland Center. And of course, our program sponsor for this project, which was the Ohio Department of Medicaid. And also, I need to mention that the views that we express today are really not the views of the study sponsors, but our own views. So to take any onus off of them. Next slide. And you can go to the next one. So our hub, why do we have quality improvement hubs? Well, we know that coordinated collaboratives can have a really strong impact on health outcomes. And for us, regional and statewide efforts and quality improvement activities in health systems and clinics are often fragmented and doing different things. And having that coordinated primary care collaborative can have a strong impact on health, especially if we're organized in quality improvement projects that focus on specific areas across a region. And I like to show this picture. Oh, sorry, go back. You're so fast. I like to show this picture because when you're looking at rowers, and they're all rowing together, they really move swiftly and efficiently, and they get to the finish line, and they're all working together. And if you have one person that's just out of sync, then it can really slow the whole process down. And that's gives you sort of a visual representation of that trying to be aligned and coordinated together. Next slide. So Ohio Department of Medicaid funded 6 medical schools across the state, and you can see here where they are. 3 we're going to focus on diabetes initially for their quality improvement work, and 3 were focused on hypertension initially for their quality improvement work. Next slide. So I apologize. I think there's some overlap in words here. But I will just talk you through it, that in 2023, we were funded initially to build that infrastructure to help support providers and develop some community engagement work. And then we enrolled about 73 across the state, around 20 in our region, that were participating with us on these quality improvement projects. And then another 73 were recruited for a wave 2 in 2025. And the goal for Medicaid is really to continue to increase engagement and then realize the benefits for Medicaid enrollees across the state as we continue to engage more and more practices and communities. Next slide. So this is our hub in Northeast Ohio. We are combined, Case Western Reserve University and Northeast Ohio Medical University working together. And that's in partnership with Ohio Department of Medicaid, the Government Resource Center at Ohio State, Ohio Colleges of Medicine, who help support the administration of the program. Next slide. And this is all of our project leads. It really does take a lot of folks working together to make this happen across the region. So I'm not going to go through each and every one of them, but just a lot of people working together. Next slide. And this is our steering committee, basically a number of health systems across the region to help drive this, as well as a community partner in the work. Next slide. So our quality improvement hub is really meant to translate best evidence care into clinical practice, offering a structure to collectively support health improvements that can be measured at the level of Ohio's populations. And our Achieving Health Equity and Diabetes initiative, our first initiative, was really to improve blood sugar control in adults enrolled in Medicaid with type 2 diabetes in our region. And also for specific population groups, we knew that Hispanic populations and Black populations had worse blood sugar control, and we really wanted to make even greater improvements for those groups as well. Next slide. And why focus on diabetes? Well, it is a lot of people have it. 38 million Americans have diabetes. The rates of those who've been diagnosed have doubled in the past 20 years. We know it influences people's quality of life. It's a primary cause of blindness, leg amputation, and kidney failure. Diabetes costs a lot. It's estimated to cost $413 billion in medical costs. But also the issue of lost work and wages, and quality of life and disability. And people with diagnosed diabetes have more than twice the average medical cost than people without diabetes. Next slide. Again, I'm not going to go too much into this, except to say that we're trying to improve blood sugar control so that we reduce complications that are associated with uncontrolled blood sugars. And these are a number of strategies to do that. There's a lot of different ways to do that, optimizing medication regimen, getting people to diabetes self-management education and support, etc. I do want to point out one area here where, which is sort of focused in this area that we'll be talking about today, which is the equitable environment for care and healthy lifestyle as we think about produce path or produce prescription. Next slide. And again, I know this is a lot of information on one slide, but just to say that where we are in 2026, we're just finishing with our Wave 1 practices. We're getting close to finishing the first year with our Wave 2 set of practices. We get every other week electronic health record data submitted to see where they are with blood sugar control and some of the processes. And then we work with them monthly with a quality improvement coach with the practices to try and make improvements. We have monthly webinars with the practice sites to share best practices about what they're doing. We have a patient team with lived experience with diabetes at our practices that come together and share their insights into the project and help us do better. And then we have meetings with our Medicaid managed care plans, and we have work around community engagement, which is where this falls into. Next slide. And this is one of our last slides I'll show you before we get into the meat of the program, but this is just our Wave 1 sites. We have about 36,000 people at those 20-some practices with diabetes. And looking at the percent with elevated sugar, we want this to be lower, so lower is better in this case. And we started with about 18% of people having sugars or A1C above 9. And then we are now at around 15% of those folks having elevated sugars. So we're really making a difference and really excited. I won't go into all the different interventions that are happening. This is a host of different things that clinic sites are working on to try and improve the health of their patients. Next slide. So how does the Produce Path coupon program really fit into our Northeast Ohio Quality Improvement Hub? We had this sudden opportunity for a 3-month pilot program to add to our diabetes-focused initiative. And we were told about this opportunity about a month before it was going to start, which was in April 1st, that we had the opportunity and we had to use those funds by June 30th. So it was a very rapid turnaround. And we debated whether we wanted to even apply for anything, but we thought there may be something we can do to help in some of the areas that we're seeing for diabetes. Food insecurity was one of the top social needs that are identified by our primary care clinics for our patients. And we know that providing access to healthy food options helps prevent or improve chronic conditions like diabetes and reduces low blood sugar. So really trying to have an impact there. So we reached out to the Case Western Reserve University Swetland Center. We're delighted to have them be willing to work with us on this to see if we could support a produce prescription program with coupons for patients for healthy food. And with that, I think that's my last sort of intro slide, and I'll really let Owusua and others talk about the program a bit more in detail.
All right. Thank you, Dr. Bolen. In the next few slides, I'm going to share about the program and how it was implemented and also share some results from the program. So the Produce Path Coupon Program, as Dr. Bolen said, it was a very rapid response program that leveraged a farmers market app that we had developed over the past decade and partnerships with clinical practices, farmers markets, and market educators to implement a PRX program for Medicaid, Medicare, and uninsured patients at select primary care sites in Ohio between May and June of 2025. Each patient that participated in this program received $100 in fruits and vegetables coupon. They were in $10 increments. They also got information about how to access the app, which we call Produce Path, and also education from farmers market educators on how to, go to a market, and also some nutrition education as well. So when I say produce prescription, I know most of you are familiar with this program. So this is a food-based intervention that allows healthcare professionals to prescribe fruits and vegetables to individuals with chronic conditions and limited access to nutritious foods. Patients who participate in these programs usually can fill their food prescriptions either at food pharmacies, farmers markets, grocery stores, or in some cases, the food are delivered to their homes. One thing that we want to highlight is that at the heart of these PRX program is the belief that food is a preventative medicine. So really, when you think about our program, it was informed by some of the barriers and opportunities from past produce prescription implementation. We know that healthcare systems are predominantly not designed to provide produce prescription. And so implementing these programs really require partnerships as well as payment models that will support the program. Also, we know that there is extensive literature that shows a positive association between produce prescription programs, fruit and vegetable consumption, and cardiometabolic health. However, the reach and uptake of these programs are often very low. This is mostly because patients are either not aware of the program or they are not aware of where to redeem their coupons, or there are other factors that may also be influencing that as well. We also know that in other programs, example like WIC, they have used mobile applications to increase uptake successfully over the past few years. So we really had these, coming into the program to really think through how can we be innovative given the time that we have, the resources that we already had, and the partnership that we had built over the past couple of years. And so we work with primary care practices, farmers markets, educators to implement a program. And our program was supported by trained program staff, as well as the Produce Path app that I mentioned, which I'll talk more about in a little bit. So for the primary care programs, we invited 15 primary care practices who were participants of the NeoQI hub that Dr. Bolen spoke about in Cuyahoga, Portage, and Summit counties. And then given that our goal was to reach Medicaid, Medicare, and uninsured patients, these clinical sites were primary care sites that had largely our target patient population that we were looking for. About 87% of the practices that we invited agreed to participate in the program. And prior to implementation, the primary care practices provided a space for program staff to recruit patients. They also provided dates that they thought was a good time, a date and time that they thought was good for coming to the site to recruit patients based on, their record of who they're going to see during those times and days. The primary care staff also raised awareness about the program among patients using program-provided flyers. And all recruitment happened at the primary care sites. So their patients were recruited and enrolled in the program, and they received their coupons and information on where to use their produce prescription coupons. We also engaged farmers markets. So for this program, farmers markets were the redemption site for the coupons. We invited 8 farmers markets that were within 5-mile radius of the participating primary care practices. 7 of these farmers markets agreed to participate at redemption sites. So for these farmers markets, their managers were predominantly responsible for, 1, informing vendors about the program and what patients could use the program to purchase at these markets. They were also responsible for reimbursing vendors for all the coupons that they received once patients purchased produce from them. The managers also tracked coupon redemption data to ensure that they have the right amount of coupons that they have received compared to what we had given to patients. They also submitted invoices for all redeemed coupons to the research team in order for the markets to be redeemed. I want to highlight that all these markets receive a prepaid amount prior to implementation of the program in order to support reimbursement. And then following the end of the program, those that had more coupons than whatever we gave them, we reimbursed them for that as well. And then when we come to the Produce Path app, our managers were responsible for updating the content on the app and also engaging market users through posts on the app. We also had program staff available at the market every week to answer questions from patients, vendors, and market managers. We thought that was really helpful in order to keep the program running. If they had questions, they had somebody right there to ask them about it. Now here I show 3 maps: Cuyahoga County, Summit County, and Portage. As you can see, we do have clinical sites on each primary care participating sites in each of the counties. Each of the counties have at least one participating primary care and 1 farmers market. Cuyahoga County had the majority. It had about 8 primary care practices and 4 farmers markets. As you can see, majority of these practices were within a 5-mile radius of a farmers market, except for this one that was pretty much close by. Most of them were within a 5-mile radius of the participating clinical practice. So we also recruited 4 community educators from implementing communities. So we wanted to find people in the community that could engage with patients when they enrolled in the program, provided them information about how to shop at the farmers markets, and also provided them additional resources on healthy eating, as well as the app. So these educators were pretty much available at every primary care site when we were recruiting, and they answered questions of patients about how the program runs, but also how do you download the app, what kind of information can you access on the app. The educators also provided patients with their closest farmers market that were participating. So at some point they were even like writing on cards for them, like, this is a market you can go, here is the day they are open, here are the hours they are open, in addition to providing them with the information about the app as well. So a little bit about the Produce Part technology. So the Produce Part customer portal is a customer-facing web-based mobile app. It is available in iOS and Android, and it's powered by data that is supplied by the farmers market manager through another the manager portal of the app. The customer portal offers a comprehensive suite of features intended to enhance the farmers market and address consumer awareness barriers. So the contents of the consumer portal include market discovery and logistics. So you're able to see information like the market's name, the address of the market, the hours the markets are open. You're also able to see posts from farmers markets. So these posts could be educational posts, nutrition education. It could be posts about our market is closed, things that farmers market users could use to inform their decision to shop at the farmers market. Users can also see inventory, so likely available produce that are going to be available at the farmers market to help them plan for their farmers market shopping. There is also a grocery planning tool in there that you can use to plan your trip, make your shopping list and check off on that list if you are done shopping for them. We do have the app available in Spanish version as well for consumers to use. So this is the app that we paired up with the Produce Prescription Program in order to support the use of the coupons that were provided to consumers. So now what did we learn? Who did we enroll in this program? So overall, a total of 431 patients were enrolled in the program over the course of 6 weeks that we implemented the program. Majority of these patients were Black and females with a median age of 56. Based on self-reported data, we found that about 69% had a cardiovascular disease, with hypertension being the highest. Almost half of the patients that we enrolled said that they had been diagnosed with hypertension. We also used the hunger vital sign to screen for food insecurity, and based on that screening, about 80% of the patients that were enrolled were at risk of food insecurity. Also, majority of the patients, given our eligibility criteria, majority of them had Medicaid, and about 5% were uninsured at the time of enrollment. In terms of program uptake, about 51% of the patients redeemed their coupons at participating farmers markets. A total of about 41% of the value of the coupons that we distributed, which was a little bit, I think was like almost $18,000, were redeemed at the farmers markets. Among those who redeemed their coupons, about half of them used all the coupons that they were provided. And more than half of them also redeemed the coupon at 2 or more visits to farmers market. We also found that 33% of the people that redeemed coupons went to 2 or more farmers markets. It's really important to note that more than half of the people who used their coupons had never been to a farmers market prior to participating in this program. We also found that food insecurity was lower among those that redeemed coupons compared to those that did not redeem coupons. We have not tested for the statistical significance of these differences, but we noticed that there is that difference. With regards to the app, we found that the Produce Path app acquired 89 new users during the program implementation, which represents about 20% of program participants. So definitely there's still opportunity to increase adoption, but we did find that some of the patients that were enrolled used the app that was provided. In terms of benefits to the program, we did conduct focus groups with program participants to explore some of the benefits and barriers of the program. Patients said that the program increased their access to healthy foods while also giving them the opportunity to interact with farmers and vendors at the markets. In terms of barriers, one of the main barriers that was highlighted was transportation. It was a major barrier for some patients. Patients also shared that there was limited availability of fruits and vegetables at the market during the time when the program was implemented, given that that was very early in the season. Patients expressed that it would have been helpful if we could go beyond like July in order to get like access to more variety and quantity at the market. A few patients also mentioned their inability to use the app. Although they got the information about the app during enrollment, we found that the app was not really integrated into the program as much as we would have wanted to. So our team ended up providing information about markets and the hours through like phone calls. So we had patients calling for us to provide that information for them. So that was also helpful to have that as a backup for the program. Yeah, that is it for the program. Turning over to Dr. Freedman.
Thank you, Owusua. Do you mind pulling down your slides?
Yes.
Great, thank you so much. So I want to start off and see if anyone in the audience would like to ask any clarifying questions of Dr. Bolen or Dr. Yamoah about the Neo QI Hub and the Produce Path Coupon Program. I did see that Kelly DeBrose you have your hand raised, and if you have a question, I can allow you to chat. It looks like you removed your hand. And then if you do have a question, if you don't mind raising your hand, and then we can allow you to ask your question. So any questions directly for our two speakers? Okay, if you do have a question related to anything as you're listening, please feel free to raise your hand, or you can directly type it into the chat, and we'll pause at different points to get those questions. So I'm going to begin, and I just wanted to make sure, did we lose Miss Mamie? Because I don't see her in here.
Yeah, I think so.
Okay, yeah. She was here, and now
and Darcy, Ruth's hand is up.
Oh, okay.
Yeah.
Hi, Ruth. I'm going to go ahead and allow you to talk. Okay. There you go. Ruth.
Thank you. I was curious to know if the West Side Market, which has recently opened its vegetable stands, was a participant in the study. Darcy, you and I were there and thought there might be opportunities.
Yeah,
Thank you, Ruth. So at the time when we implemented, I believe they were still going through the reconstruction and refiguring. So they did not participate in the program. They were not part of the program. But we did get feedback from some of the partners that work with West Side Market when we're designing the produce purchasing program, particularly with like how much, should the vouchers be $10 or $20? That was something that we engaged with a lot of the partners who directly work with West Side Market to inform.
Thank you.
Yep.
Okay, well, I'm going to go ahead and begin the panel conversation. I know maybe Owusua, because you've got a minute before you'll be asked a question, if you want to reach out to Ms. Mamie to see if she can come back.
Yeah, I'm doing.
Okay, thank you. All right, so let's kick it off with Traci. So Traci, as a farmers market manager, can you share about your role in the implementation of this produce prescription program?
Hi, Darcy. Sure. Good morning, everyone. Pleasure to be here with everybody. And thank you to Case Western Reserve for reaching out to our market. So for the Produce Path program, we facilitated the on-ground support. So we provided a dedicated space at the market table for the Produce Path staff. So our Produce Path staff was Naomi, and she was stationed specifically to answer questions and guide our Produce Path customers through the redemption process. At our market, the first thing that customers see when they enter the market is our welcome table. So we have a dedicated space for food assistance, for SNAP, for WIC, and then of course, Produce Perks, and then Produce Path. So all of our customers that currently are in those different channels of food assistance, Naomi was right there, able to educate those folks and, excuse me, just give them program-specific information. Operationally, our requirements was, of course, training for our vendors and staff on the program specific rules. So letting vendors know that, you know, this was a new coupon coming through for the month, and to, of course, continue to welcome those folks in and answer any questions and help engage and help them make purchases with those coupons. And then, of course, coupon logistics, managing and tracking redemptions, and then the administrative oversight, managing specific compensation and ensuring the terms that we were given to ensure the program was sustainable.
Thank you, Traci. And I think you bring up some important points that are more in the weeds of the program, but some of you may be interested. We did have a student worker who came to the farmers market, like Traci said, Naomi in this case, who was there present on site to help somebody navigate and how to use their coupon. That's some of the barriers we've heard in the past is people get there and they don't necessarily know what to do. As well as training. Most markets in our community are operating multiple incentive programs or food access programs. And so it was important to make sure that everybody knew how did the Produce Path coupon program work, which foods were allowable. For example, could you buy plants with the coupon? Was that acceptable? And then lastly, we didn't mention, but the back end of Produce Path does allow for tracking of every transaction. And so we were able, like Traci said, to know how many transactions happen at the individual level within the farmers market. So thank you so much, Traci, for providing that background. And for those folks that are not on the call, do you want to just briefly describe your farmers market?
Sure. So we are the Cuyahoga Valley Farmers Market, and we are located in the Cuyahoga Valley National Park. We are at Howell Meadow during the summer months, May through October, and then we are indoors at Old Trail School, November through April. We are one of the only, actually, we are the only farmers market in a national park in the nation. So one of our core missions focus is on food access. So we really pride ourselves in making our market a safe, welcoming, high value space for every shopper in our community.
Great. Thank you so much, Traci. Shari, I'm going to turn to you now. In your opinion, what are some of the key ingredients for successful partnerships like the one that we have here between clinical practices and the varied stakeholders that are involved in a PRX program?
Great. Yeah, I think that's a good point that typically these kinds of things take a little bit longer because you really want to meet the partners that you're working with, establish relationships, have aligned, goals and activities and build trust. And so that really does take time to do all of those many things. And a lot of our health systems do have food as medicine clinics or other things that have really generated and developed partnerships with either the food bank or farmers markets or local community growers to really help develop these kinds of programs in a long-term fashion with that sort of authentic trust. I mean, I think we were lucky in this sense because we had a very short time frame, and really Swetland Center in this instance had really developed a lot of those relationships with the farmers markets. And we were able to, when we had spent a long time developing the relationships with the primary care practices. So it was a really nice way to come together quickly in a way that might have been challenging if you were just newly meeting a bunch of partners for the first time.
Yeah, I think that's a good point that you're making, that the stakeholders that were involved in the primary care sites as well as community, each of those are their own set of stakeholders, their own set of relationships. And I think one of the things that became a unique opportunity here was that, the linkage, right? Where the partners in one area that were already working together and partners in another. Do you think there's anything, you and I happen to know each other, but for other groups like doing this, how do you think somebody would find that linkage space in their community?
Yeah, I think that's a good point. Sometimes we start things that other people are already doing, frankly, because we don't know everything that's happening in our community. So that can be a challenge. I think really trying to reach out to groups that are doing community engagement work already in your region really helps you. Like for us, we have our clinical translational science collaborative with a community engagement module. And so Darcy and I actually co-lead that. So that's partly how we know each other. Although we knew each other beforehand, but that's, for instance, one group you can go to and say, hey, we really want to partner with someone. Do you know the region? And I don't know, Darcy or Owusua or others may know of other groups that have really good, I'm certainly within hospital systems, there's community engagement groups that do community engagement for their health system. So that is probably another place if you're in the health system where you can learn about it. But I don't know if you have others that you may be aware of, Darcy.
No, I think I think your point is really important, that don't assume the partners aren't already existing and reach out and ask before you begin to develop, try to develop all those new relationships, see if they already exist. So thank you so much. I'm now going to turn to Owusua. I know this was a rapid response project. So, from your perspective, what were the most rewarding or exciting or novel aspects of implementing the program at such a fast pace?
Thank you, Darcy. So this program was built on several years of work within the food system in the area, and that really allowed us to rapidly pivot when this opportunity became available. We already had relationships with the farmers markets through our work around the Produce Path app and also the REACH grants that we've been working on over the past few years. We did develop the app a few years ago, and some of the community educators that we was also involved were people that we had worked with in some of the works that we've done in Cleveland and around Cuyahoga County. So really these relationships and the tool made it a little bit easier to pull this together in a very short time. Again, our partner also at Northeast Ohio QI Hub also had these working relationship with the primary care practices, and they facilitated those connections with the primary care program. So it was also like really exciting to see the willingness of everybody, like the primary care providers, the farmers market managers. We work with Traci and others before, and they are always looking for these opportunities to support people who come to their farmers market. So that willingness and excitement was also very encouraging to see. I think oftentimes we are like, oh, would they like it? Would they want to do it? It's probably too much work. So I think that was helpful. I think for innovation, I do feel like having program staff at the clinical sites was very helpful and innovative in the sense that it removed a lot of the burden from the clinical staff to do the actual prescription and enrollment by themselves. And with their feedback and their supports, it really helped. There were like times that our staff would say, oh, like then the MA like showed this person and brought them over. And sometimes they will even call us, are you guys coming here? When are you coming here? Because the patient is asking. So that partnership and willingness to support was really, really helpful. I also think rewarding wise, I think it's heartbreaking to see the amount of families who need this resource, but it was rewarding to see the impact of such programs. I was at some of the farmers markets and met some patients that were so excited about the opportunity. So I think that was helpful. We actually have recently received an email from one of the primary care sites asking if you're going to do this again. So really there is a need and there is an enthusiasm within all these partners to support families who may need these resources.
Thank you, Owusua. And it makes me think about a principle in population health that we're always balancing this tension between efficiency, which of course, a lot of things here deeply rooted in strong partnerships allowed for efficiency, but there's also issues of equity that sometimes when we make something efficient, it may be less equitable. Do you think there's any areas where, if you had a little bit more time, you could have addressed some concerns to make the program more equitable for all of the potential patient population?
Yeah, I think one of the things that I kind of have been thinking about is one, we were given the time that we had to work off relationship that we already had. So really like the market that got to participate, the primary care providers that got to participate were really, restricted by who we knew and what. So really not every part of Cleveland had access to these programs. So that is one that I think would be if I had the money and more time, I would want to think about how to equitably make it available in, other areas. I also think the markets that participated, if we could like expand to include more markets, right, to really include the average or even include like local farmers, right? How do we get other local farmers to incorporate their produce into this program will be something that would be really amazing and would also impact the local economy and these people who are cultivated in these communities. I think another thing that I would definitely love to do is really incorporate patients' feedback in the design of the program itself. We did get feedback from the clinical sites, we got feedback from the farmers market managers, but the group that we were not able to get feedback from whilst we were designing were the patient. So really including patients to think to how do you want this done? Where do you want to get your food? What kind of food do you think they should cover? And being more thoughtful about that, I think will be really helpful and ensure more equity.
Great, thank you so much. Traci, I'm going to turn it back to you. Can you share more about the impact of the Produce Path coupon program that ultimately had about almost $18,000 redeemed at local farmers markets that were going directly to support vendors, as well as the customers? Maybe you had a chance to interact with some of the customers participating in the program.
Yes, thank you, Darcy. So for the vendors, our direct revenue for summer 2025 was $610 that the Produce Path coupons redeemed coming in. Food assistance is a vital pillar of our revenue that helps support our vendors and farmers. So customers using these programs often buy in higher volumes, which helps reduce farm waste and ensures fresh food moves quickly. I have, and I believe she's on our call right now, Tess, our market assistants, assistant actually had some really good quotes come in from folks that use food assistance. So we know that community cares and values being able to shop at a farmer's market. They love all the fresh food and love being able to come and just participate in the farmers market and get their education from the farmers. So, speaking to that trust and health, having a friendly face like Naomi from Produce Path at the table, in addition to our market staff who are well versed and well educated in the food assistance, helps those customers or helps reduce the stigma often associated with food assistance programs. So we've really cultivated a reputation where every shopper feels respected regardless of their payment method. So, Produce Path was a part of that, and we were happy to add that layer into our already available programs for our community.
Thank you for that, Tracy. And I think one thing that stood out to me in your description was all the ways that this program is making a difference, from reducing food waste, which we really wouldn't have thought that was our primary goal, to reducing stigma. Those are all, I think one of the exciting opportunities with programs like this is that they have ripple effects, right? Benefits that are beyond the initial intent, and those also have a potential to influence issues around sustainability and things like that. So Shari, I want to come back thinking about the future. What challenges do health systems face and when they think about maintaining or expanding support for produce prescription programs? And how do you think programs could proactively address some of those concerns in the design?
Yeah, thanks, Darcy. I think we struggle with this in terms of sustaining different programs on the health system side, and several of our health systems in our region have, as I mentioned, food as medicine clinics where they have providers referring patients with food insecurity and chronic conditions to their food as medicine clinics for fresh fruits and vegetables, and so dietary wraparound support, and often social worker or community health worker wraparound support as well for those individuals. And I think a lot of these programs are paid for through local foundation support or their community benefit program. So it's not, and they're always constantly searching for funding to continue to maintain them. So I think, the larger issue around maintaining these is making sufficient strides in supporting the investment in this to the insurers, and not just Medicaid, but probably CMS, as we think about, ways that people can cover food as a prescription and food programs in a more sustained manner. And there's a couple different things, that are out there trying to make that happen. And Darcy, you may be even more familiar with those than I am, but some of those are just looking at different ways Medicaid and Medicare can cover these different services as an actual health service so that health systems can be reimbursed for the personnel that they have. And even though a lot of these places get the food for free or very low cost, there's still a charge, even if it's free, for transporting that food to the food as medicine clinic. So there's a lot of fees beyond just the food to help sort of keep those programs going. I don't know if I answered, there was probably a two-parter there, Darcy, but I think continuing to work with our insurers is sort of where, and making the case that this is improving health outcomes. And, we do still need to test what different models work for different patients and and having different options, just like we do for, medication treatment or surgery treatment. Like we often offer different options to people that work. for them. And so thinking about the right model and then maybe having a couple different models that work well may allow patients to get the food they need in a more convenient way for them.
Great, thank you so much, Shari. Owusua, would you be able to follow up on some of those points? Like, what's the Swetland Center and our partners in the REACH grant? What are we doing around issues of payment and reimbursement to address some of the concerns that Dr. Bolen mentioned?
Thanks, Darcy. So as part of the REACH grants, as you have heard, this is funded by the CDC to the Cuyahoga County Board of Health, and we are a sub-recipient on that. And the Swetland Center leads the fruits and vegetable strategy. So that strategy is mainly designed to increase the number of people that are using fruits and vegetable incentives and produce prescriptions in communities at highest risk or burden of chronic disease. So as part of that grant, the center is spearheading two large initiatives. So one, we recently launched the RFA to support the implementation and evaluation of different produce prescription programs that are locally rooted in Cuyahoga County. Linnea, I think, put the link in the chat, but if you're interested, that is one way that you can, apply and we can provide support through that. And then we also convened the Produce Prescription Working Group, which is a collective of 60 plus individuals who are working to advance policies that support the expansion of locally rooted produce prescription program in Cuyahoga County. The working group is currently designing a standard operating procedures for locally rooted produce prescription program that will support partners that are looking to implement the program or who are already implementing the program. And some of the things that we are talking about in the SOP include payment models, pulling resources on how to support that for a local farmer or a local nutrition educator. We are also working through the working group to identify opportunities for shared resources and infrastructure to make it easier for more local growers and nutrition educators to sell culturally relevant fruits and vegetables for produce prescription program. That is also an ongoing effort. We are currently interviewing farmers to really identify their interest and what kind of shared infrastructure they would be willing to support if that was available to them. So through this initiative, we are working really hard as a center to really build some of these infrastructure that, based on our experience, we found that there were gaps. So the goal is to build it so that the next person who is doing this does not have to start from scratch like we did. They would have some resources to support that program.
Thank you so much.